name is Helen Christians, and I'll be your MC this morning. I'd like to welcome you to Sunday morning meeting of the Humanists of Greater Portland. The Humanists of Greater Portland is a chapter of the American Humanists Association. Humanism is a democratic and ethical life stance that affirms that human beings have the right and responsibility to give meaning and shape to their own lives. Kathy Humble's our reader this morning.
This is chiefly a memoir of Elizabeth Warren's campaign in the last presidential election. The book was published in 2021, and she was famous for so often responding to questions with, "I have a plan for that." So I'll read several quotes from the chapter called A Planner. I'm a lifelong planner. I was never the "I must account for every minute of my time" kind of planner. No, I was the "wow, here's something cool and a little outside our reach that we could do, and here's a plan for getting it done" kind of planner. The way I saw it, planning expanded my range of opportunities. Let's begin with the role of the federal government in making plans. One clue is right there in the preamble to the Constitution. We established this country to provide for the common defense. And what does that common defense actually cover? Most people who encounter this term probably think immediately of our military, troops, weapons, military bases. Some people might give it a second thought and also include our State Department and diplomatic corps, the people who serve as our eyes and ears abroad and help negotiate our alliances and disputes with foreign governments. But there's more. Broadly speaking, providing our common defense requires that we recognize powerful threats, potential if North Korea hit us with nuclear weapons. In the 21st century, we are facing two huge threats that require our government to provide us with a common defense: pandemics and climate change. Both could do at least as much damage as a military attack, and both should spur urgent calls to make detailed and comprehensive plans. My brother, who served in the military for 20 years, who made it through nearly 6 years of combat in Vietnam, will forever be part of the coronavirus statistics. Even as I grieve, I am deep down angry with a president who lacked the leadership, the courage, and the basic humanity to step up and develop a plan to deal with this crisis. Even as I mourn my brother and watch the rising death toll, I know that this coronavirus is not the worst possible threat to our health and well-being. Think about the possibilities that lurk in the next pandemic. What happens to our economy, our people, and our nation if the next contagion is much deadlier, if we don't have a plan for the next pandemic? And then there is climate change. If our government can't provide a common defense against this most dire of threats, we may not have a government. We should be thinking about how we can do everything possible to prevent the destruction of our home planet. And that takes hardcore, no more time to waste. Get on it right now, planning. We need a government that provides for the common defense by developing comprehensive plans that will keep our children and their children safe. To me, what it means to be a serious candidate for president, you show your plans. I traveled to countless places and talked about my plans to anyone who would listen. And here's the thing. People came to hear me out, sometimes dozens, sometimes thousands. They wanted to hear about my plans, and they came with questions and with challenges, and most of all with hope. Yet in the end, I lost. But ask me, how sorry am I that I put out really strong plans on climate change, or eliminating private prisons, or debt relief for Puerto Rico, or affordable housing? How sorry am I that I ran for president and put out a boatload of plans? Not one bit. That's it.
That was great, Kathy. Thank you. I'd like to now welcome today's speaker, Dr. James Crooks, who will be presenting the health effects of climate airborne exposures. Dr. Crooks is an associate professor and research scientist at National Jewish Health, a respiratory research hospital in Denver, Colorado. In this role, Dr. Crooks co-directs the hospital's Environmental Epigenetics Research program, as well as the Colorado Consortium for Climate Change and Health, a statewide research network bringing together medical professionals, epidemiologists, and atmosphere scientists. His research examines the links between climate and air quality, health, and equity. Following his graduate training at UNC Chapel Hill, he worked for 2 years at Duke University and 7 years at the U.S. Environmental Protection Agency before joining the National Jewish faculty in 2015. He lives in Denver, Colorado with his wife, Christy, and 2 teenage sons. Welcome, Dr. Crooks. So pleased that you're able to join us today. Thank you.
Can you hear me okay?
Sure can. Thank
All
you.
right.
And
Well,
Dr. Crooks will be taking questions at the end of his presentation. Yes.
well, it's a real pleasure talking to you today. There are several people on this call who I've known literally my entire life. So very grateful that you thought me worthy of speaking to your group today. This is so much fun. I love talking about this stuff. I will preface by saying that the topic today is kind of a downer. It's a little bit depressing, and if you come away feeling like, oh my gosh, this is horrible, that is a natural response, and I want to validate that response, but I hope that that response does not prevent you from taking action, because I cannot give you hope. You know, hope comes from within, and hope comes from acting. So I hope that my hope for you is that this prompts you to take action, because that will give you hope. All right, I'm going to share my screen now. So I'm going to talk today about the health impacts of climate-driven air pollution. And I'm going to talk sort of air pollution generally, what are the health impacts of air pollution, and then how they tie into climate change sort of in the second half of the talk. All right, so quickly a little bit about air pollution basics. What are the major air pollutants? Which are the ones that we tend to focus on a lot from the health perspective before we move on to some other topics? All right, so the EPA under the Clean Air Act regulates air pollution in the United States. And it's important to know which ones are actually regulated and how. So the most important category of air pollutants are what are called criteria air pollutants. And these 6 air pollutants are mandated by the Clean Air Act that the EPA has to regulate. So there is a process set up in the Clean Air Act for the EPA to regulate them and then review their regulations every 5 to 10 years to update them as new science is brought in. All right, and so carbon monoxide, which is a product of any kind of combustion process, is probably going to be emitting carbon monoxide. So, you know, a forest fire or burning coal or whatever. Sulfur dioxide is almost always from coal burning, because coal is sulfur bearing. You get some from volcanic eruptions as well, but we don't regulate that. Ozone is an air pollutant that is developed as a product of chemical reactions in the air from other kinds of pollutants. Nitrogen dioxide, another product of incomplete combustion that you get usually from cars or power plants. And particulate matter. So I'm going to be talking about PM, and then PM with a number behind it a whole lot this talk. And that there's many sources. We'll talk a lot more detail about particulate matter. And then lead. There are other categories of air pollutants that are regulated as well. So there are hazardous air pollutants. And the distinction sort of in the regulatory approach between these two is that the criteria pollutants are regulated at the level of a city or a metro area, like a big area, whereas hazardous air pollutants are regulated kind of at the point source. So like if there's a power plant, there will be a permitting regime imposed on that power plant if it's emitting mercury or polycyclic aromatic hydrocarbons and other things like that. So they're regulated at the point source, whereas the criteria pollutants, those are the ones that are regulated, you know, citywide. And then the Clean Air Act also has a mechanism in it for the EPA to determine that new air pollutants that Congress had not envisioned are actually dangerous and need to be regulated as well. And that's called an endangerment finding. And in 2009, the EPA made an endangerment finding for greenhouse gas, for carbon dioxide. Now, the endangerment findings are not real strong legal foundation on which to regulate, because the next administration can come in and say, well, this is sort of up to the executive branch's discretion, so we're not going to actually regulate these at all. So the Trump administration tried to roll back the endangerment finding on greenhouse gases. I think they did not succeed. But because there's not a process that is directly in the statute for updating a regulation and how to do it, the endangerment findings tend to be pretty like loose foundation for building a regulatory regime. One of the reasons we don't have great greenhouse gas emission limits in the US. Now I'm going to be talking about 2 of those pollutants because there are 2 of them that we know the most about from a health perspective and that we monitor really well. And the first is particulate matter and the other is ozone. So particulate matter just means anything that's solid or liquid phase that floats in the air. And we've known for a long time that they're very dangerous. They have sources ranging from industrial sources to natural sources. Coal and oil burning, the soot from coal and oil burning, vehicle brake and tire wear, diesel exhaust, natural sources like wildfires that you've certainly experienced a great deal in Portland, dust storms, sea salt. And then there are what are called secondary sources. That is, sources of gaseous emissions where the gases then condense into solid phase after they're in the air, or into liquid phase after they're in the air. And so the ammonia from fertilizer fumes will, as the ammonia is emitted, as it floats downwind, will sometimes condense into tiny particles. Same with the nitrogen oxides and sulfur oxides from power plant emissions and leaks from oil and gas development. So even if something isn't directly emitting particles, it can still cause particle concentrations to get higher downwind. When we talk about health impacts of these particulates, the property of the particle that we tend to focus on the most is the size, because the size dictates how far into your lungs the particle can get. And so like larger particles, we don't even regulate because most of them are from natural sources, and also your body has really good defense mechanisms against them. So we don't regulate anything above 10 microns in the US. But we do regulate the particles below 10 microns. So we call that PM10. So the 10 is for the size, the diameter of the particle. 10 micron particles can get into your lungs, but they tend to get the upper few branchings of your lungs. So like your sternum up and up. That's sort of where they tend to get stuck. Your body has some defense mechanisms against them, and you can kind of cough some of them out, but some of them do get stuck there. The nastier particles are the PM2.5. Those are the ones that are 2.5 microns across. They can get all the way down all the branchings of your lungs, all the way to the gas exchange sacs. And you really have very poor defense mechanisms against those particles. It's very hard to cough them out. And so they tend to get lodged there, and sometimes your body has to kind of fight them where they stick to your lung. And then finally, a particle class that we don't actually regulate but are really important are called ultrafines. There's not a real strict definition for what that means, but usually people say it's less than 1/10 of a micron across, maybe 2/10 of a micron across. And we know these are even more insidious because they can pass through any biological membrane in your body that we know of. They can pass through the placental barrier and get into a placenta and probably into the babies. They can pass through the blood-brain barrier and get into your brain. We actually have studies in cadavers where you can find tiny particles stuck in cadaver brains that are surrounded by nodules of immune cells. Like, we know these things can get anywhere. And they're probably passing through the lung lining into the alveoli, into your bloodstream, going wherever in your body. Some of them are probably passing through the membranes in your sinuses, and maybe into the vagus nerve, into your brain. So particles can get basically anywhere, and that's a real problem. Now, before we really understood that these smaller particles were more dangerous, as we studied kind of particles in general, scientists realized that, yeah, we know that there are links between particle concentrations in the ambient air and exacerbation of chronic disease like asthma and emphysema. We've known that since the 40s, these crazy London fog events where there would be so much coal smoke in the air that people couldn't see their hand in front of their face for 2 weeks. It's been very clear that those kinds of events in London or in LA or in Pittsburgh were causing such extreme air pollution and really driving a massive increase in the number of people dying and going to the hospital. So these connections were very, very well understood even at the dawn of the Clean Air Act in 1970. As we started focusing on smaller particles that your body can't clear out as well, we found connections with longer term diseases like COPD and lung cancer, as in a sort of analogy to smoking, right? We know smoking causes COPD and increases the risk of lung cancer. Particulate air pollution in that 10 micron size bin, we found links to these same endpoints. But something really weird happened in the 90s. As scientists started studying the smaller particles that get all the way down all the branchings of your lung into your gas exchange sacs, they started finding links not to respiratory diseases, but to cardiovascular diseases. And this is a real surprise. We now understand that there are links between particulate air pollution of the smaller size bin and exacerbations of cardiovascular disease like stroke and heart attack, as well as kind of longer term chronic diseases like congestive heart failure. And this is not intuitive at all. Like, when you go outside and the air pollution is really bad, your lungs feel tight or you start coughing. Like, it makes sense that there's a lung link there, right? Like it's going to affect your respiratory system. But if you have a heart attack 3 days later, you're probably not going to think, oh, it was the air pollution that I was breathing back on Wednesday, right? Like that's not a connection that gets made. But even though it's not intuitive, the link between particulate air pollution and cardiovascular endpoints is the most important link that we know of by far between air pollution and health outcomes. So when you think about the respiratory outcomes and how bad, your lungs feel in high air pollution days, that's just kind of the tip of the iceberg. Like cardiovascular endpoints are far more impactful nationwide and worldwide because there are so many people with chronic respiratory disease that can get exacerbated by air pollution, and so many people whose development of cardiovascular disease can be kind of accelerated by long-term air pollution exposure. So why is this happening? Like, why is there this link between particulate air pollution and cardiovascular disease? Your cardiovascular system is not your lung, right? Totally different organ system. So how is this happening? Well, there are a couple of different mechanisms that we understand now pretty well. There's one where the particulate gets lodged somewhere in your lung, causes a local inflammatory response, and that inflammation doesn't just stay in your lung. It's sort of those inflammatory cytokines and other like cells, they spread to the rest of your body. And your inflammatory response in your body, whatever it's attacking, your body is basically making a bet. It's basically saying this inflammatory response will damage us, but at least it will get rid of the invader, right? Because your inflammatory response is there to get rid of like, an infectious disease or a bacterium, or, you get a cut and you want to make sure that there aren't any things getting in through the wound, right? So your inflammatory system is a bet that you're making that, the inflammatory response itself will damage your body less than the invader will, right? But if you're getting chronic exposure to air pollution over years, well, you're getting kind of constant low-level inflammation everywhere all the time. And that inflammation can damage your body. It can increase the rates of, increase like the arterial plaque thickness, and it can, in an acute sense, sort of break one of the arterial plaques loose and cause a stroke or a heart attack. So localized inflammation in your lung doesn't just stay there. Then there's also translocation, where the really small particles can get through the lung lining into your bloodstream, travel anywhere in your body, cause a localized inflammatory response, like in your brain or in your heart itself, or wherever like that. And so obviously a localized inflammatory response in an organ that's already stressed by some other chronic disease is going to cause a problem. And then there's this other mechanism we don't understand as well, where particulate pollution seems to be disrupting the brain's ability to regulate your heart rate. All right, so inflammation plays an incredibly important role in the health effects of air pollution. It's really hard to understate just how important inflammation is. And over the past 20 years, as we've understood the role of inflammation better, we've realized, oh, hey, inflammation is actually not just involved in cardiovascular disease, it's involved in all kinds of other disease. Maybe there's a link between those and air pollution. And in fact, there is. So in the past 20 years, there's been a massive explosion in our understanding of the breadth of air pollution's health effects. We have birth developmental outcomes in young people. We have dementia, Alzheimer's disease, Parkinson's disease, cognitive declines in older folks, both the risk of developing dementia, Alzheimer's, and Parkinson's, as well as the trajectory of those diseases once you have them. We have metabolic syndrome, diabetes, obesity, and the list keeps growing. I mean, the last year we could, there's indications that we could be adding COVID-19 to this list, as well as other infectious diseases, kidney diseases. I mean, there's a whole pile of stuff, depression and other mental health outcomes. Like, it's amazing just how broadly we are now as scientists thinking about air pollution's health impact. Now, the impact on any one of these outcomes in one person may be relatively small, but when we're looking across many, many people, the overall population impact is very large. And we'll come back to that in a minute. And in fact, one indication of how broadly we're now thinking, there was a paper that came out 2 years ago now, where this research group looked at basically every health outcome they could think of and just said, hey, is there a link between this health outcome and particulate air pollution in the Medicare cohort over 15 years? And so they recapitulated a bunch of results we'd already found in cardiovascular and respiratory diseases, Parkinson's, diabetes, et cetera. But they also found stuff that they never expected to find. links to septicemia, fluid and electrolyte disorders, acute and unspecified renal failure. Now, that's just the first study. It would need to be corroborated with further research, but this just, I think, underscores just how broadly we're thinking right now. There is no organ system that is not impacted by air pollution. So what about ozone? That's the other air pollutant that we tend to focus on a lot. We know it has health impacts and we monitor it pretty well. So for ozone, you've probably heard of ozone in a couple of different contexts, depending on where in the atmosphere it is. So there's the stratospheric ozone, that is the ozone layer, which is vital for life on the surface of the Earth to exist. Without the ozone layer, plants would have a very hard time growing, and agriculture and just life on the surface of the Earth would be quite a marginal exercise. So we really need that ozone layer. But ground level ozone is actually really bad for us. We don't want to be breathing ozone. It is a lung irritant and harmful to breathe. Now, it's important to underscore it's the same gas in both places. It is the same triatomic oxygen molecule in both places. It's just serving us when it's high in the atmosphere and hurting us when it's low in the atmosphere. And by hurting us, I think a good analogy here is that ozone is the hydrogen peroxide of the air. What do I mean by that? Well, hydrogen peroxide is a water molecule, that is a molecule we need for life, plus an additional oxygen atom attached to it that completely changes the chemistry, makes it much more reactive. And there is a reason we don't drink hydrogen peroxide. There's a reason we don't have bathtubs full of hydrogen peroxide. It will hurt us, possibly kill us, right? That extra oxygen atom makes a huge difference. Ozone is the same thing. It is diatomic oxygen, which we need for life, plus an extra oxygen atom that makes it much more reactive and damages our lungs. It actually damages our skin. It damages plants growing. It damages cows. I mean, like pretty much anything that's alive, it will react with and cause at least some amount of damage to. All right, we do not want to be breathing ozone if we can help it. Now, ozone has natural sources, but it also has man-made sources. So it has nitrogen oxides and volatile organics are the main precursor gases that in the presence of sunlight and heat will react together to form ozone. So you need those three elements. You need nitrogen oxides, which you often get from power plants and cars, volatile organics, which you can get from natural sources, as well as from oil and gas development, or just like oil and gas leaks, in combination together with heat and sunlight. So sunny days in the summer, particularly in the afternoons, that's when you tend to have a lot of ozone. Winter nights, you tend to have very low ozone. Now, why do we care about ozone from a health perspective? Well, it's been clear since kind of the smog concerns back in the 70s at when the Clean Air Act of 1970 was passed, that ozone as a main component of smog was responsible for exacerbating chronic lung diseases like asthma, emphysema, and COPD. But just like with particulates, as we started to understand the role that inflammation plays and how the health impact plays out, we started to understand with ozone too that like when ozone is reacting with your lung, it's causing an inflammatory response, and it doesn't just in your lung. So while we haven't studied ozone quite as well as we have with PM 2.5, we have studied it enough to be pretty sure that there are links to the progression of chronic cardiovascular disease with exacerbations of cardiovascular disease like heart attacks and strokes, with metabolic changes, Alzheimer's disease, type 2 diabetes. And again, this list keeps growing as we study it more. And it's important to also understand that not only are we finding more health outcomes are related causally to air pollution, we're also finding these causal links at relatively low concentrations. So it doesn't take a lot of air pollution to be measurably increasing your risk of some of these outcomes. It just takes a little bit. So how do we regulate it in the US? Well, there are two statutes that have sort of piled on top of each other that allow us to effectively regulate air pollution in the US. And they are the Clean Air Act amendments of 1970 and 1990. There were actually previous Clean Air Acts that did nothing, that essentially just asked people nicely to stop emitting, which did not work at all. So finally, the Clean Air Act was given teeth in 1970 and then updated in 1990, both by Republican presidents. So if you look since the most recent update to the Clean Air Act, the 6 main air pollutants have gone down, like their national concentrations have tended to decrease. Some of them a lot, like lead actually has come down since 1990 by like a factor of 15 or something crazy. And that's well after cars stopped using leaded gas. Plenty of the others have gone down a lot too. So SO2 has gone down tremendously. This is the blue color here from coal plants putting scrubbers or just going out of business altogether. Some of the others have gone down modestly as well. The one we sort of still struggle with, ozone, certainly in urban areas, tend to be higher than the most recent EPA rule, the standard. PM 2.5, let's say, which is the dark green here, is also has come down, but certainly there are places, there are hotspots that have high concentration. And you'll notice like a leveling off over the past 5 years. I think you probably can guess why that might be. You know, a lot depends on how aggressive the presidential administration wants to be in terms of regulation and in terms of tightening the regulations that already exist, both enforcement and changing the regulation. Now, the Clean Air Act really works. We can measurably tell that it works. So this study that came out about 10 years ago, February 2011, was basically looking at the benefits of the Clean Air Act amendments of 1990, and they found they were projecting that by 2020, almost 250,000 deaths in the US would be averted. Almost basically 200,000 acute heart attacks, 2.5 million asthma exacerbations would be averted just because of the Clean Air Act amendments of 1990. That's a really big health burden. And in fact, the methodological technology for estimating the benefits of air pollution have actually gotten much better in the decade since this study came out. So there are basically every year we look at it again with more updated methods, kind of the stronger the impact looks. So here's a study that came out 4 years ago that was looking at the Clean Air Act as well, and said specifically we estimate that because of declining PM 2.5 concentrations, so just looking at the one air pollutant, between 1980 and 2010, life expectancy of US residents born in 2050 will be almost 1 year longer than it would have been if PM 2.5 had stayed constant in 1980 levels. So basically a year of extra life expectancy because of the Clean Air Act. Like, it's hard to find any other thing that the government does besides vaccination that has a role that big, that has an impact, positive impact that is that big. Now, some of that work was done by people at the EPA, and so it's useful to look at the kinds of the similar kind of study that is done by someone who is not at the EPA. So here is a study that was done by the Office of Management and Budget. And if you've ever worked in the federal government, you've probably heard that the people in the OMB are not your friend. Like, they basically don't like anybody and think they're the smartest people in the room and like to tell other people that they're doing things wrong. They do a study every couple of years where they look at the costs and benefits of federal regulation over the prior decade. And they look across different federal departments at who is regulating what. And every time they do it, every single time that I have seen in the past 20 years, the EPA always has by far the biggest monetized benefit and also the biggest monetized cost. But the ratio between them is on the order of 30. So like roughly-ish $30 of benefit for every $1 of cost. The impact of the air quality regulations are just enormous. And specifically within the EPA, it is the air quality regulations that are the ones doing the heavy lifting. All right, it's the Office of Air, which does the air regulations. So by far the biggest benefit of any federal regulation is the air quality regulations. Right, I just cannot underscore that enough, how important that is. And the way they monetize the benefit is they put a value on a statistical life, or they put a value on hospitalization, and they sort of add up all those dollars. All right, enormous benefit from federal regulation of air quality. And the proof is kind of in the pudding. If you look at the places around the world that have effective air quality regulation, they have cleaner air, right? Whether it's the US, the EU, Japan, in places where they're either just recently implementing effective air quality regulation, or really have no effective air quality regulation like India, they have higher air pollution levels, like much higher. China's made big gains in the past decade, but they've only been doing this for a decade, and they started out in an incredibly horrible place, like indescribably bad air pollution in Beijing and some of the coastal cities. And India is kind of in that spot now. Air pollution regulation, if it's effective, can really, really improve life. Now, that doesn't mean that air pollution regulations in the US are perfect. They're not. If you look at where our current standards are for major air pollutants compared to where the World Health Organization recommends they are not in the same place at all. So the World Health Organization air quality guidelines were just updated like a month ago. And so I'm going to put the old ones and the new ones both on this table here. So the old ones were generally at least kind of in the neighborhood of where the US EPA was putting the regulations. So the PM 2.5 annual standard in the US was 12, the World Health Organization guideline was 10. Now it's 5. So like well below half of what the EPA standard is. For the 24-hour standard, which is the spikes, it's trying to regulate the number of times that spikes exceed a certain concentration. That threshold value was 35, it's now 12, right? So their definition of a spike at the World Health Organization has gotten much, much tighter. And so their recommendations are far below what the US EPA considers bad. And the difference is even more stark with NO2, which is, this is not a typo, literally 10 times lower than what the US EPA standard is. So, I mean, we do better job in the US than almost any other country in the world, probably any other country in the world in terms of regulation, but we still have a long way to go. So let's talk about the global impact of this air pollution and what that means for the US. There are a number of studies that have tried to just look globally at every country in particular and say what is the loss of life expectancy, what is the mortality impact, that kind of thing. And they use sort of different models that have improved over time. So here's a study that came out in about a year ago, and it was looking at life expectancy changes because of air pollution. And it found that globally, because of cardiovascular death caused mostly by PM 2.5, that the loss of life expectancy from air pollution rivals that of tobacco smoking. That's astonishing. I mean, tobacco smoking is an amazingly deadly thing. And loss of life expectancy from ambient air pollution and household air pollution worldwide is actually almost as bad. And that the global mean loss of life expectancy for air pollution strongly exceeds that by violence of all forms by an order of magnitude. So 10 times as many people are dying from air pollution as from violence worldwide. Amazing numbers. Another study that came out last year with a different methodology that was through what's called the Global Burden of Diseases Project. They found that air pollution was the number 4 underlying risk factor for death worldwide. Number 4, it is the highest environmental risk factor by far. And it was responsible for 6.67 million deaths worldwide in 2019. So it was only behind high systolic blood pressure, tobacco, and dietary risks. It had a bigger impact than other underlying risk factors like high LDL cholesterol and malnutrition. And in fact, if they had done the study a year later and looked at the first 12 months of COVID, worldwide, air pollution would have still killed twice as many people as COVID. Okay, the impact of this is enormous. And within that 6.67 million deaths is 12% of all deaths in 2019. Within that 12%, 1% is ozone, 7% is outdoor PM 2.5, and 4% is household air pollution from usually low and middle income countries, people burning wood and dung and things like that for home heating and cooking. So if you have an open flame in your house, replace your stove. You don't want to do that. A new study that came out actually this year with, again, a slightly updated methodology, looked just at the particulate and ozone pollution just derived from fossil fuel burning. And they found that fossil fuel burning was attributable, let me see if I have, okay. Sorry, no, this is a different thing. This is still the global burden of diseases. They found that most of the deaths due to air pollution in the global burden of diseases are amongst people who are, say, over 50 or 60. So really, these deaths are being driven amongst this older population. And so worldwide, of all COPD deaths, 40% were driven by air pollution. Of diabetes deaths, 20% attributable to air pollution. Same with ischemic heart disease, lower respiratory infections, lung cancer, and stroke. So air pollution is an incredibly important risk factor amongst older folks. I just am always boggled that AARP doesn't get this and is not paying attention to this issue as far as I can tell. Like, they need to be like warning people about air quality much more than they are, because it's really, really an important issue for older folks, both because they've had a longer chronic exposure over, 60 years of life instead of like me, 45 years of life, that contributes to risk later in life. But also, once they have a chronic disease, they're at higher risk of exacerbation that could kill them, right? So this newer study that just came out this year with a slightly different methodology that's just looking at mortality from air pollution just caused by fossil fuel burning. So not total air pollution, but just the subcategory from fossil fuel burning. So they found that air pollution from fossil fuel burning was responsible for 20% of global deaths. So this is different methodology. Previous one got 12%. This is getting 20%. But you're looking at a ballpark that's still really, really horrible. In the US alone, that was 355,000 deaths in 2012, or 12% of total mortality in the US, caused by just fossil fuel burning, PM 2.5. That's it. That means if you look at kind of the first year of the pandemic in the US, our country has been experiencing 2/3 of a pandemic worth of deaths every single year just due to pollution from fossil fuel burning. All right, every single year, and we have zero sense of urgency about this. Mind-boggling to me how underreported this is, how little this seems to get into the media landscape and the broader conversation. 2/3 of a pandemic each year, even before COVID. All right, let's talk a little bit about Portland. You probably know more about this than I do, but I would feel remiss if I didn't bring it up a little bit. Clearly, you've had some serious problems the last couple of years. If you go to the American Lung Association website for they basically do letter grades for different kinds of air pollution, specifically the ozone and particulate pollution. And the most recent data is coming from 2017 to 2019. So the past couple of years where it's been like aggressively horrible are not counted in these grades. All right, so you get a C for ozone because you exceed the US EPA standards for ozone a certain number of times. You get a C for particulate pollution 24-hour. Again, you have a certain number of spikes above a threshold, more than the American Lung Association thinks you should, and then you get a pass on particle pollution annual. That is the annual average. So you have spikes, but most of the time the background is pretty low, so that's why you get a pass on this one. So I went and pulled some of the data from the monitoring for PM 2.5 and ozone for the Portland metro region, and so here's where the monitoring is for PM 2.5 and ozone. There's actually some PM 2.5 monitors that are co-located with ozone monitors, and they're kind of hidden by the squares. So there are 4 PM 2.5 monitors and about 11 ozone monitors, give or take, in the area. If you look at just the time series of, in this case, PM 2.5 concentrations over time, where I've the top horizontal line here is the 24-hour standard that you're not supposed to exceed more than a certain number of times. And the bottom horizontal line is the annual standard. That is, the annual average shouldn't exceed this threshold. And wow, you guys got hit real hard back in 2020. My goodness, I've never seen anything like this in the US before, anywhere that I've studied it. I guess this must have been like during the wildfire thing. We're talking multiple weeks with concentrations so far in excess of the 24-hour standard that it's on. I mean, I can barely graph them on the same graph. Incredibly high concentrations. Actually, ozone, not so obviously bad. Ozone tends to have an upper bound because of like it's derived from precursor gases, and if at some point you're just not using all the precursor gases to make ozone, and there aren't any more, and so it would be nearly impossible for you to get 80 part per billion of ozone. But you are getting exceedances of the EPA standard several times a year. I guess 2019 you only had one, 2020 it looks like you had maybe four. 2021 you actually didn't have any ozone exceedances, amazingly. And wildly, so this spike in smoke, I'm guessing, blotted out the sun so much that the ozone formation reactions were depressed. And so ozone was really low during that period of time. Usually it goes the other way because smoke tends to have a bunch of the precursor gases to make ozone. But if there's so much smoke that it blots out the sun, then the reaction turns around and ozone can't form. So I hope that you all have gotten very comfortable with this AQI thing, the air quality index. So the air quality index is a health risk index to help you determine, like, is it safe to go outside and do certain activities in a given day? And it's actually taken, we don't, the index value is not a concentration. Let me just make sure you understand this. It's basically a mapping between concentrations for different pollutants. So each pollutant has an individual AQI, and then the one that's reported out is just the worst of all the different pollutants. So if you have an ozone AQI and a PM AQI, the one that's reported is whichever of those on a given day is higher, is whichever one is worse. All right, so each one has a mapping between them. And they go, the color codes go from like air quality is satisfactory in the green, moderate, air pollution is acceptable. However, there may be a risk for some people, particularly those who are unusually sensitive to air pollution. Unhealthy for sensitive groups. Members of sensitive groups may experience health effects. Basically, if you're retirement age, you're probably a sensitive group. That would qualify you. If you're a young child, you're probably in the sensitive group. So be very aware of the orange. And then anything above orange is just terrible for basically everybody. And I would encourage you to mitigate your exposure as much as you possibly can. I would also say, because these boundaries are determined by where the EPA standard is and not by the WHO recommendation, if you're at the upper range of one of these categories, like if you're at 95, I would just mentally bump yourself up to the next category, right? Because I still think, and most scientists probably think, that the EPA standards are not sufficiently protected. So I haven't talked about climate change at all. What about climate change? Let me back up and give you just a very quick one-slide primer on climate change, and then we'll talk about how it impacts air quality. All right, so we are undergoing an unprecedented global experiment. We are putting ourselves and our planet through an unprecedented change. And it's hard to really grasp the unprecedentedness of that change without looking backward in time. And so here is data on global CO2 concentrations from 800,000 years in the past to the beginning of the Industrial Revolution in the early 19th century. And we see in that period global CO2 oscillating on a fairly regular basis between about 180 part per million and maybe 280 or 300 part per million. All right. The way I've graphed it, it doesn't look like that big of a change, but it's an enormous change. In fact, every time the CO2 has dropped down this low, that's when you get an ice age. I don't just mean it's a little bit colder. I mean, it's so much colder. There is a half-mile thick ice sheet on top of Seattle, on top of New York, Minneapolis, Chicago. Like, it is a drastically different planet when CO2 is this low. All right. We have never, our civilization has never lived in that kind of an environment. All right. Everything that we think of when we think about civilization, whether it's agriculture, cities, writing, that has all occurred since global CO2 has been above 250 part per million. All right, that is the world that our civilization thinks it has as its baseline. That is how we manage to make cities, right? That is how we manage to have agriculture in that kind of world. Now, since the end of the 19th century, we've been adding lots more CO2. And so if you look at 2017, we'd essentially added 130 part per million more CO2. And the impact of that has been to raise global surface temperatures by about 1 degree Celsius. You might be wondering, if the difference between 180 and 280 was enough to melt a half-mile thick ice sheet on top of New York or Seattle, why have we only seen 1 degree Celsius change when we've added another 130 part per million? And the reason is, well, twofold. First of all, it takes a long time for that additional CO2 that we've added to the atmosphere to trap additional heat. Okay, that is a process that takes centuries. And so basically, like, even if we froze CO2 levels globally at this level, our planet would continue heating up until it was significantly hotter. Also, it takes a long time to melt a half-mile thick ice sheet on top of Greenland. So we sort of have good news and bad news. We have not cooked ourselves yet, which is good, but also there's a whole lot of heat that is kind of built into the emissions we've already done. Okay, the CO2 we already have is going to heat our planet more. But we're not stopping emitting, right? We're going to keep emitting. We've kept emitting since 2017. And it's important to understand the kind of scenarios that scientists and policymakers have been putting together. Since maybe a decade ago, they put together a set of scenarios to use in what are called the IPCC reports, the Intergovernmental Panel on Climate Change reports. There's a new one that came out a couple of months ago. I haven't updated the slide, so this is from the last one that was in the early teens, right? So they used 4 scenarios. There was like the good scenario where global CO2 by the end of the century reaches only 420. And then there are 3 bad ones. And the kind of bad one, it's actually really bad, but in this, you know, the range is relative here. The kind of bad one is the RPC 4.5, where we hit 540 part per million at the end of the century. RPC 6, 625 part per million at the end of the century. And then the burn everything on the ground scenario, RPC 8.5, where we get up to 930 part per million. Remember, this was enough to melt a mile-thick ice sheet on top of Seattle. We just cannot imagine the kind of change that would be in store for us if we get up here, or even here for that matter. We do not want to live in that world. Now, where have we actually gone in the last decade? Because these scenarios were developed a decade ago. Well, as of 2014, we were firmly on the high emissions trajectory. Since then, we've fallen off it a little bit, not aggressively, certainly not aggressively enough to meet the Paris Agreement targets, not anywhere close. So we're probably still looking at a future of, you know, over here in terms of total emissions. Not good. Now, what does that mean for our air? Well, certainly it's going to get hotter, and it's going to kill people just because it gets hotter. So if you look at how these different RPC scenarios map onto temperature change, we see that the low emission scenario would give us basically 1 degree of additional warming over what we already have. The high emission scenario would give us 4 degrees Celsius. That's about 7.5 degrees Fahrenheit of additional warming. Of course, that doesn't really affect the whole globe evenly. So some places warm faster than others. The oceans, because the water buffers the temperature change, the oceans warm slower than the land, and inland parts of the land warm faster than the coastal parts. So us here in Colorado, we're very inland. We're going to warm faster than, you know, California. Also, places that are more toward the poles tend to warm faster than places that are more equatorial. All right. So the closer you are to the North Pole, unless you're in this little patch where Greenland ice sheet is going to melt, if you're closer to the pole, you'll probably heat up faster than the equator. Now, what does that mean for climate and air pollution? Well, we know wildfires are getting worse. You've obviously experienced the joy of horrendous wildfires in Portland. Throughout the Western US, they're getting worse. Number of very large wildfires is going up as they kind of, you know, a smaller number of very large wildfires more than replaces the drop in smaller wildfires. So a massive increase in very large wildfires in the West, an increase in the length of the wildfire season in the West, where it gets getting earlier and earlier in the year and a little bit later in the year as well. Wildfire smoke is a mix of stuff, some of which we understand really well, and some of which we don't really understand really well. So the stuff that we understand really well are like PM 2.5, you know, the particles in the air, PM 2.5. We know what that does to us. We have a pretty good handle. We have a decent handle on what carbon monoxide and nitrogen oxides do. We don't really have a good sense of what polycyclic aromatic hydrocarbons do. We know in like from experiments, toxicology experiments on animals and in studies of people who work in job environments that have a lot of PAHs, the pHs, some of them can cause cancer, as can volatile organics, but we don't really understand the health effects of these huge mixtures of lots of different kinds of chemicals. Particularly when a fire goes through an urban area and it's burning all kinds of things in your house. There are many things in that soot or that gas coming out of that fire that we just don't know what they do. But what we do know are the effects of PM 2.5, nitrogen oxides, and carbon monoxide, all of which are bad. Also, as I said before, wildfire smoke can increase downwind ozone levels because it contains nitrogen oxides and volatile organics, but doesn't always, because if there's enough soot in the air, it blocks the sun and inhibits ozone formation. Now, we've seen an increase of roughly a 300% in number of acres burned per year since the 1980s. So now a good year for wildfires, for acres burned, is about as bad as a bad year would have been in 1986. So the fire regime in the West is changing drastically. And there have been studies to look at sort of how much of that change is attributable to climate change versus other factors. The one that is most important, the study that came out and did this the best found that over half of the documented increases in fuel dryness since the 1970s and doubled the cumulative forest fire area since 1985. That's what climate change has done. All right, so a majority of this increase, at least 50% of this increase of number of acres burned is due to climate change and not other factors. And the projections for the future are pretty scary. If you look at the high emission scenario, that burn everything in the ground scenario, we're looking at massive increases in the number of weeks per year with risk of very large wildfires. Just by the middle of the century, not even by the end of the century, just by the middle of the century. Pretty much everywhere west, north, and south of where I live here in Denver is going to have more wildfires. But also, coastal areas in Florida and then coastal southeast, as well as like we just had really bad wildfires in Minnesota this summer, and I think that surprised a lot of people. And of course, ozone is also going to get worse. Ozone is temperature sensitive, and even if you do nothing else, ozone tends to get worse. So there's this thing called the ozone climate penalty, where if you look at how much your city has warmed up because of climate change, you can estimate how much additional ozone you are experiencing because of that climate change. And so you can do this. Here's a couple of cities in California where you can look at just what's the empirical link between ozone concentration and temperature. You can do the same thing for Denver. Basically, any city in the world that has an ozone problem, you're going to find a positive slope between ozone and temperature. And so as the planet warms up, you tend to get more ozone just because of the chemistry. So this is all pretty dark, but I do want to leave you with two parting thoughts before we switch to questions. The first is that immediate and aggressive climate action can be justified solely on the basis of short-term air pollution improvements and resulting lower morbidity and mortality. That's really important because a lot of discussion about climate action and costs and benefits talks about this thing called the social cost of carbon, which is looking at, okay, what is the impact of the economy of carbon emissions today, but when we look out 50 or 100 years, right? And there's lots of debates about what's the right discounting rate and all this wonky stuff. And I'm like, y'all are missing the point when you're talking about social cost of carbon, because the social cost of carbon doesn't actually include the short-term health benefits of the co-pollutants that you are emitting when you burn carbon, right? All that stuff, all that PM 2.5 causing 355,000 deaths a year in the US, not included in the social cost of carbon. If you include it, in fact, you don't even have to use the social cost of carbon. You can just say, okay, PM 2.5 from fossil fuel burning is killing 355,000 people a year in this country. We should not do it anymore, right? And by not doing it, you effectively fight climate change because you reduce emissions of carbon as well, because it happens to be emitted at the same time as the PM, right? So immediate and aggressive climate action can be justified just based on short-term benefits. So if you're talking to older folks who are like, well, that's not my problem, I'm going to be dead. Well, yeah, you're going to be dead because you're going to be killed by this stuff that you're breathing now, right? That's being burned at the same time as the carbon. Like, it's not just about the long-term impacts, it's also about the short-term impacts of people today, right now. All right. Which doesn't mean we shouldn't be talking about long-term impacts. We absolutely should. And particularly those of you who have, like, you know, grandkids or neighbors who have grandkids or whatever, it's important to understand that when we are talking about the future, we need to be thinking a really long time in the future. Half of the babies born in the US this year are going to live into the 22nd century. That's what? Yeah, okay, that's like Star Trek time, right? Like, that's super duper far in the future. But if you look at it, the life expectancy at birth in the US is 79 years. We are 79 years away from the 22nd century. So we need to be not only thinking about the health impacts among us today, but we also need to be thinking about what kind of world are we going to be leaving people behind 80 years from now? People who are alive now, people who we know. We need to be working for them. Right. And that's it for my talk. And I think there's probably time for some questions.
Oh, do we have questions? Wow, Dr. Crooks, that was it was quite enlightening. And you're right, we don't know about this. It's not making this is so much new knowledge that you shared with us today. So thank you. Let's start the questions though, because we're going to have many. Dell has a question. Does the N95 masks protect from the fine particles such that's in a wood shop sander or in a metal shop sanding copper or iron?
That is a great question. And I'm guessing if you can see the particles in the air, they're probably bigger than 2.5 microns. And the N95 will work quite well against them. Okay. The other kinds of particles that are smaller, they don't work quite as well. They do work some. So it's probably good to wear one if you're outside on a smoky day, or if you're working, you know, in the kind of situation you were just describing. But also, if the main thing you're being exposed to is the PM 2.5, you know, the smaller particles, the N95s are not going to work perfectly. So if you have to go outside, it's probably good to wear one. But if you cannot go outside, that's probably even better.
Okay. Okay. Kathy Humble has a question. Kathy, can you come on and ask your question, please?
Yes, I have a question about particulates. It's a several-part question. When I lived in New York City in the early 60s, in my cheap apartment without air conditioning, whenever I opened the windowsill would be covered with these little black blobs. They were tiny. They certainly weren't microscopic, but they were tiny. Now, number one, chemically, what were they? Number two, were they large particulates? And does that mean that along with them, I couldn't see all kinds of small particulates? Number three, have the EPA regulations been effective enough that if I were to open that window today, they wouldn't be there? Four, if they weren't there, would the smaller particulates, the invisible ones, still be there?
Okay, so my information on New York, because it wasn't well monitored in the 60s, is probably more relevant to the 1980s rather than the 1960s. So in the 1980s, a lot of the soot that you were seeing in the air would be from oil burning for heating the buildings. Some of it would be from industry in the New York metro region. There were probably some coal power plants that you were getting some particulate from, but I'm guessing a lot of it was building heating at that time. Either sort of indoor, like people burning things in their apartments, or outdoor, like, or not outdoor, but the you know, building wide heating and cooling systems that had to burn things. Oh, I'm so bad at multi-part questions.
Yeah.
So what kind of particles? Well, we don't know in the 60s because we didn't monitor anything back then, basically. Like, I have no idea. It was probably a combination of lots of things, because there probably weren't good filtering devices on the soot coming off those heating systems. So it was probably a little bit of everything. Nowadays, you would probably, unless it's a really cold spell where there's a lot of building heat cranked all the way up, or unless there's wildfire smoke coming in, you could probably open your window and not see soot. It's much better. A lot of the heating systems in the buildings have been converted either to cleaner oil, or they have filters on them to filter out the soot, or they just don't burn oil at all. They've been switched to electric, a few of them. So the real attention on particulates from a regulatory perspective has been on the smaller particulates for the last 20 years. So the larger ones have not really, their regulation hasn't been updated since the 90s, whereas the smaller particulate regulations have been updated as recently as 9 years ago was the most recent time. So yeah, most of the focus, because the smaller particles get further into your body and the health impact is bigger, generally speaking, most of the tightening focus has been on the smaller particles.
Good. Al Christians has a question. Can you come on, Albert, please?
Oh yeah, I have a couple of things I'd just like to get some updates on. I'll just throw them out quickly, and you can talk about any of them you have anything interesting to say about. One is the effect of carbon dioxide in the atmosphere on human cognitive function, intelligence, and ability to think straight. And the other is, are there strategies for just avoiding these particulates because they fall out of the air? Should we be allowing larger following distances when we're driving down the road behind a big truck? Should we not be having agriculture next to interstate highways, stuff like that? Should we be just relocating our activities maybe a little ways to just give the particulates a certain part of the earth and move someplace else?
Okay, so yes, there are impacts of heating, CO2 levels. There are impacts of CO2 levels on cognitive function. We know this. We can measure it in buildings. You know, a lot of times inside buildings, you'll have CO2 levels of up to like 1,000 parts per million instead of 400. And we can measure the impact of that on cognitive function, and there are decrements. We know this. They're not huge, but they do exist. And so if the whole world had a CO2 level of 1,000 parts per million, like we would be slightly stupider then. Now we're pretty stupid right now emitting carbon, but you know, maybe it'll make us stupider. In terms of mitigating exposure, if you're in a car and you have a relatively modern car, you can recirculate the air inside, it's going to go through an air filter, and that air filter is going to do a decent job of capturing the particulates. In terms of other kinds of mitigation, climate action is what's going to do it. Like, it's, everything else is sort of like a Band-Aid. But if you want to mitigate exposure for yourself, having a relatively tight building envelope for your house, an indoor air filtration system that works pretty well, even just like room-specific air filters can work pretty well, and don't burn things in your own house. That's what you can do.
Dave Gray has a question. Dave, can you come in, please?
Hey, Jim, I haven't seen you for 20 plus years.
Oh, that's right.
Hey, Dave, how are you?
But I have heard that you were getting involved with some pretty advanced science. And now I have very strong proof of that. So I do have a couple of questions. One is, I presume that you, especially because you're a former EPA employee, are keeping track, maybe because of personal contacts, with what EPA's, are they keeping up with all this data that you're so involved in? Secondly, is Congress, any committees in Congress, are they interested in hearing about this stuff? Have you or any other experts and or EPA experts testified before Congress on these problems?
Oh, well, it's great to see you, Dave. It's such a pleasure.
Yeah.
Okay, so yes, I have caught up with my friends at the EPA, and I think certainly during the Trump administration, there was a lot of frustration and a lot of anxiety, I should say. And in terms of the regulatory process, the EPA really short-circuited its regulatory process as much as it could during the Trump administration. And they were even discussing like eliminating some of the rules that were already there that are really protective of people. They ended up not, but they also tried to like gum up the gears a lot to prevent the next administration from being able to make quick progress. So that was super frustrating. They also like to do things like add more kind of oversight to the science that's being published by EPA scientists and things like that. That's a real pain in the ass and really frustrating to a lot of people. So none of my friends left, actually, but my friends are a little bit insulated from some of the policy making. And the second part of your question, what was it about? You remind me?
Has Congress been asking for information about this? Senate committees, House committees?
Yeah, not that I know of. Certainly not. I mean, I'm not such a big wig that they would call me, but there has been a little bit of attention on social. There's been a fair amount of attention on social cost of carbon calculations, and a little bit on the sort of health costs associated with it, but just a little bit. And there's only one hearing that I can think of where it was brought up. I think it's just not making it. It's just not making it through the noise. And one of the things that's frustrating is that these calculations of the health burden and the calculations for the social cost of carbon are done by two different groups of people who don't really talk to each other. One is the economist and one is like the epidemiologist. And it's too bad because the social cost of carbon, if you actually accounted for the social cost of all the co-pollutants emitted at the same time as the carbon, would be like 3 times higher, like much, much, much higher. And the fact that they're not accounting for the co-pollutant health impacts is like super frustrating.
Right, right. We have a question from Carl Levine. Can you talk about gas stoves a bit? What's the scoop?
Okay, so gas stoves. We actually switched out our gas stove a year and a half ago because I was so mad at gas stoves. So gas stoves do emit things. They emit nitrogen oxides and carbon monoxide because it's combusting. And that just goes with any time you're combusting anything. If there are any leaks, the underlying gases are methane and ethane. That's what natural gas is. And those are volatile organics. And so those aren't good for you either. Like they're not the worst, but they're also not good for you. And so you're emitting a whole lot of gases into your air that are not good for you. And if you're not ventilating your kitchen area really well, then you're just exposing yourself to a bunch of stuff you don't need that's going to be bad for you. Like, why would you do that? So I really recommend, if you can afford to make the switch from gas to electric or induction, like it's well worth it. And all the, the gas industry loves to like give money to cooking influencers to talk about how great their gas stoves are, but like, no, that's propaganda.
Okay, and I think Nancy has a question similar. How about gas heaters? Are they safe?
They're also going to be emitting some gases you don't like in your house, potentially, or at least the area right around your house. Mm-hmm. So, we need to stop using gas appliances, period, from a climate perspective, but there's also an immediate benefit to our local air quality in and around our house. If we can get off those appliances.
Okay. Mike Berchet has a comment. It seems that for every proposed solution for cleaner energy, there is a criticism about its negative impact on the environment in its manufacturing or its disposal. Comment?
Sure, yes.
Mm-hmm.
There is no energy that is going to be without any environmental impact. But there are some that are much worse than others. Okay. The impact of carbon, because once it's in the air, it doesn't really come out. Like it just builds up. Mm-hmm. It's hard to find another environmental impact that's that consistently bad and such a big threat to just all of civilization.
Okay. Willie has a question. Does burning indoors include, and I know you've already addressed this, the gas stoves and candles?
Certainly gas stoves and candles. Yes.
Okay.
I don't.
Yeah.
I mean, if you're just like, setting, candles on a birthday cake and you blow them out immediately, you're probably fine. But like if you're doing it, consistently every day, then that's a real problem.
Okay. Joyce Lackey, is there enough reforestation, both in the United States and worldwide, to make even a dent in balancing clean air with polluted air?
Not really. No. There has been some reforestation in the U.S. in the past 30 or 40 years. Mm-hmm. But again, it's being more than canceled out by cutting down the Amazon and other rainforests around the world. So in terms of local air pollution, the forests don't make a huge difference.
We got time.
What motivated that question for me was a book that came out in 2017 called Drawdown. I keep looking for things that are positive, and Drawdown was a very positive book about possible solutions. But but the only thing I could find that directly related to resolving air pollution was the very short section on reforestation. So, what are the positive? What else are we going to do?
Well, so reforestation can sequester carbon in trees instead of in the air, which is a good thing. And the problem is when it's framed as a one-size-fits-all solution to the entire climate crisis.
Sure.
Right? Because there's just not enough space on the earth for all the trees that all the companies that burn carbon are going to need to offset their carbon emissions.
Well,
right?
and we're cutting down forests faster than we're reforesting.
Right. So, one thing we can do that we can all do to stop that is actually eat less beef, because a lot of the deforestation that happens around the world is for cattle. Is to convert the land into rangeland for cattle, and cattle are incredibly carbon inefficient animals. I love them; they're so sweet, but no, we should not be eating anything that comes out of a cow.
Thank you.
Sheila Pastore has a question. Come on in, Sheila.
Thank you. Good morning. Two things. One is someone in my family has stopped using her gas stove and instead bought an electric, a single plate thing and put it on top, plugged it in, and she now cooks on her little electric plate. Now, that would be hard for a large family who's using a lot of pots and pans, but it's working really well for her. Once in a while, she has to turn on a gas burner. And I went down to my basement and found an old electric beautiful old electric frying pan, and I brought it up, and I'm starting to use that. A question I have is, the natural gas company person who comes out every year and does a wonderful check on my gas appliances, and by the way, that's free if anybody wants to have their gas appliances checked, told me that whenever I do use gas stove, I should always have the fan on, always. And that was a surprise to me after so many years. Look at me, I'm thinking of all the years I've been inhaling these particulates and haven't realized it. So I think those are the two things. Keep the fan on. Is it a good idea to keep other fans on, like the bathroom fans?
Yeah, the most important one is if you have one that's right above the stove. That one's going to be the most good. But other fans are not going to hurt.
Yeah. Thank you.
Yeah, and we got an induction stove, which are a little more expensive, but they're more efficient, so they're cheaper to run. You just need to make sure you have the right kind of pots, but they work fantastic. They'll boil water in like 5 seconds. It's incredible.
Nancy had a comment. She's good to hear. She's so good to hear about that comment about the cattle, because she's a vegetarian. I think a lot of us are in this group. Yeah, she's a good smile. I think will probably be our final question, but I've worked in the medical field for many years, and I know that inflammation exacerbates disease, be it any kind of healing, but just the thought that diseases are caused by these pollutants, just really, I had no idea about that, zero idea about that. That is that's just, no, I don't think many, you know it, but very few people know that.
Yeah, it's one of these things that just hasn't leaked out into the general public's consciousness very well. It's just all the different things that can be exacerbated by air pollution, and not just in a short-term sense, but over the long term. And really, it's the long term that seems to be so important. It's the cumulative exposure over your life that's seems to be relevant for how early you get a disease, or your risk of getting the disease in your lifetime, things like that. So it's really, really important.
Is your organization working to get on NPR or to talk to some of the news sources? I know that takes money to do PR. I mean, we live in a capitalistic system, and unfortunately,
Well,
it's
so my hospital, they do. I would say my research interest is not one that the hospital is super invested in. They're really engaged on like smoking cessation and tobacco use and that kind of thing. Like that's their number one kind of
oh,
clinical
sure,
priority.
sure,
Because for good reason, you know.
yeah.
But they're certainly happy for me to go on TV and the radio, and I spent a good chunk of September like fielding interviews from people. So at least local, local media outlets,
Good.
because we've had so much ozone and so much smoke this year and last year. The local media has gotten much more attuned to this kind of thing.
Well, Dr. Crooks, thank you so much first for your good work and your willingness to share with us on a busy Sunday morning. We all truly appreciate it. I think we're muted, so you won't hear our applause, but thank you so much.